Ambulance service, is the patient breathing?
A little girl, she got hit by a car.
Is the patient awake?
Oh my God.
We're coming as quickly as we can.
I need an ambulance. He's failing off the mouth.
We jumped off a bridge.
Stop it!
I think it's fucking overdose.
Please come quick, we're desperate.
Every year, 250,000 people call for an ambulance across Merseyside.
There's 2 men on the floor. Oh my God, how did that happen?
In the control centre, every single one needs a split-second decision.
Shell, got an overturned car, divert them.
Who needs an ambulance quickest and who must wait.
David, are we okay?
We need to prepare in case baby decides to come before the ambulance does.
Taking you to the beating heart of our NHS. We follow the story behind the Sirens as crews race to save lives.
1, 2, 3, 4.
They're not used, lads. Yeah, we've been lost.
Someone said once to me, you only die once, but you live every day.
Please, hurry up.
Ambulance, is the patient breathing?
No, I don't think so.
You don't think he's breathing? Okay. It's okay, calm down. We're going to help him together, okay? Are you right by him now?
Yeah.
Okay, listen carefully. I'm going to tell you how to do chest compressions.
Okay.
Okay? So place the heel of your hand on the breastbone, right between the nipples, and pump the chest hard and fast and 2 inches deep, okay? 1, 2, 3, 4. 1, 2, 3, 4. 1, 2, 3, 4.
Every day, North West Ambulance Service answer over 40 emergency calls for patients in cardiac arrest.
1, 2, 3, 4.
It's all right, you're doing fantastic. Just keep on going, okay? This is going to give him the best chance possible. Come on, 1, 2, 3, 4. 1.
Beginning CPR at the right time can mean the difference between life and death.
Paramedics going to be there any second now for you, okay? You're doing fantastic. They're there, okay?
It's the paramedics. I've asked her to stop. The gentleman's got a stasis.
Eva, okay, all right. Thank you for your help. Take care.
The hard thing is like hearing the families cry. Like,
well, you know exactly what that situation is like. To have to do that to a loved one, so...
It's like hearing that cry is horrible, innit? Bless them. Oh, on to the next.
Ambulance service, is patient breathing?
Yeah, he's breathing.
Tell me exactly what's happened.
Just slipped down the wall. He's just sitting on the floor. He's really confused.
Is he very pale?
Very grey and pale.
What's the address of the emergency, please?
Home and bargain.
The nearest available crew is Alpha 424. Gabby and Gareth are 4 minutes away.
There's daffodils for you.
Oh, yeah.
See, you said you hadn't seen any. Do you know why St David's Day is daffodils?
No, I don't know.
That's bad that you don't know.
I know, I need to find out, don't I?
Mind you, you're half Scouse now anyway.
Half Scout.
Half Scout. You're half a Scout there.
I can say chicken.
Chicken?
Chicken.
What are you having for your lunch?
Coke.
Chicken. Alpha 473, go ahead.
This is a category 2 call for a 76-year-old male. Slipped down the wall, confused and dazed. Saying he is conscious and breathing, but he's not completely alert.
This guy will need the works, won't he?
Could be a number of things.
Joseph, what were you doing at the time?
Just wait for it, not bad.
You were in the toilet, OK?
He literally went grey.
And you were just standing up?
Yeah.
Leaning on the
I
wall
just
with
slid
his
down the
hands,
wall.
yeah.
And you just went dizzy?
Yeah. I've been going dizzy a lot lately.
Have you? Do you have any heart problems?
No.
What was this BP?
106/67.
Okay. Your blood pressure's a bit low.
Low?
Something's going on. It shouldn't be that low, OK? I need to do a 12-lead ECG to see your heart.
Where are you?
I'm going to do it on the ambulance because I don't really want to show all your chest off to these women in here.
Yeah.
They'll be all crowding around us. Woo! Right, my lovely, we need you in this wheelchair. Whoa. If you're going to fall, I've got you.
Yeah, well, I'm all right.
I've got loads of muscles.
There we are, when you're ready.
Just put your bum up here if you can.
Do you want to come in, dear? Do you want me to get the ramp down and come in? Are you sure?
No, she's all right there.
I'm just going to pull this door closed then, all right, Daddy? What's your wife's name, Joe?
Not my wife. Her name's Anne.
She's just a friend of yours, is she?
Oh, Flame.
She's his flame. I like that. She's his flame. Oh. So how many do you smoke a day, go on?
About 30 odd.
And how long have you done it for, smoked?
Well, since she was 14, I think.
Oh, my God.
Now I'll have a listen to your chest. When I was 18, my dad complained of chest pain for hours before he went to bed. I didn't know at the time that if someone's got chest pain, you're supposed to be doing something. We'll do your blood pressure again. Right. We'll try you stood up. Whenever I go to a chest pain job, to me, that is my dad complaining of chest pain. Go on, take a seat. We'll take you in, mate. It's still getting lower again.
Yeah, you better tell her, don't you?
I'll go and have a chat with her and see what she wants to do.
Just take bloody, I suppose.
Oh, no.
I've popped her in the car. She's on her way, Joe. My dad collapsed in the family home. He was in cardiac arrest. We rang 999 and they're telling us to do CPR. It was very, very difficult. My dad died of a massive heart attack. I was sat at the table with my head in my hands. I couldn't work it out in my head what had actually gone on. It's heartbreaking. Every single day, I think of my dad. Take your time, there's a few grab handles there, Joe. There we are, mate.
So you're OK? Yeah, I'll do it.
It's the Friday day shift.
I know you're saying she's looked fine, but if she said that she's been assaulted, then we need to get that checked out, OK?
The Purple team are dispatching 55 ambulance crews to care for the 1.4 million people of Merseyside.
Alpha 473.
Alpha 473.
Further emergency call, please. It's a category 2 call.
She's a COPD patient.
No further details at the moment.
Oh, thank you. I'm just letting you know, Gareth, it says it's Welsh Day today, St David's Day. And what do you want me to say to her?
Bore da.
Bore da, he said.
Oh, Yaki da.
Oh, yes.
He's made up, you know.
Oh, well, happy St David's Day.
Diolch yn fawr iawn I ti gyd.
Day Welsh. Oh, thank you, and the same to you. You have a good day.
Listen carefully, I'll tell you what to do next. Have her lie flat on your back and place some towels under the bottom.
Shira Lee is one of 49 call handlers on duty today.
Tell her to concentrate on the breathing, nice, firm, steady breaths. Oh, you're doing really, really well. OK, we'll get the help to you as soon as we can, all right?
I'm going to tell you how to stop the bleeding. Listen carefully to make sure we do it right.
So someone swallowed some money?
It's my birthday on Thursday.
Is it 40?
Yeah.
Oh, I'll be 40 in 2 years.
You'll be 40 in 2 years? All right, Shell.
I'm another race.
The call waiting stack's looking quite good at the moment. We have not got much. They do say that the definition of a paramedic is someone who, when they talk about things going well, bad things will happen. So I'm not going to say things are going well, but it's quite good at the moment.
Ambulance service, David speaking.
Calling from Liverpool John Airport. We've got a full emergency.
Where within the airport?
It's an aircraft coming in.
I believe it's one patient, small aircraft, lost all radio contact.
761, thanks Dave. This call I've passed you here, it's a full emergency at Liverpool John Lennon Airport.
Advanced paramedic Dave is immediately dispatched. His additional clinical skills mean he can tackle the most serious cases.
My nearest cruiser, AMT1, do you want me to just send them? Or?
Yeah, start them on it.
Dave is 9 miles from the airport. An ambulance and the fire service have also been dispatched.
They're saying that the aircraft it's a Super 2 home-built aircraft. That's concerning.
The potential is that it could land in an estate because there's a housing estate quite nearby to the airport.
QX761, go ahead.
If you do get to take over the scene, you can give us a first report as soon as possible. Thanks, over.
When you go to some of these jobs, it's difficult because I don't think until you're there, you know whether it's something that you can help with.
Is that landed then, that vehicle?
That's what they think, yeah, but we've had no further update.
Thanks. Stand down, please. Landed safely, no issues. Stand down.
QX761, that's really good news. Thank you very much.
The aircraft lands safely at Liverpool John Lennon Airport.
Yeah. I was probably a typical 7-year-old boy. I thought I might be an astronaut or a train driver. And then I went to an ambulance station, and I remember for the first time, I was really in awe. And it wasn't just about the fact that you could drive fast on blue lights and sirens, it was about the fact that you could go and you could actually make a real difference.
Ambulance, is the patient...
An ambulance quickly, please, outside the Heart Short Centre. A gentleman's just collapsed.
Is the patient breathing?
I don't know. There's people around him. I don't know.
QX761, go ahead, over.
761, yeah, we've got a cardiac arrest outside St Helens bus station. We've got a 78-year-old male who's collapsed. Yeah, don't have a lot of details.
One ambulance and a rapid response paramedic are also en route.
And when did this happen?
Literally a few minutes ago, he started to turn purple.
He started to turn purple?
Yeah.
Right.
Hello, Eric. My name's Dave. How are you feeling, Eric? You don't know. That is a schemic, isn't it? Can we do put some posterior leads on him as well? So put 1, 2, 3 where 4, 5 and 6 are, and then we put 7, 8, 9 round the back as well, just because that might give us a bit more of a view of the heart.
Checked him for head injury or anything like that. He wasn't complaining of feeling nauseous.
Okay.
And then he's just vomited quite a bit.
There's definite pain there, isn't there? You're not feeling right, are you, mate?
There you go.
Has he had anything just flush?
Just a flush, yeah.
Okay. Nice. He looks cardiac. There looks like something cardiac's happened here. So can you remember what's happened, Eric? What can you remember?
No.
No?
Just walking along with nothing after.
Do you remember buying your bananas or your...
Oh, yeah.
You remember all that?
Yeah, I remember all that.
I'm just going to have a little listen to your chest, okay?
So that scheme is mainly resolving.
Because the bystander said he just collapsed in the street, mate, didn't he? And there was an off-duty fireman.
Yeah, I think he has, from what the bystanders have said, I think this is post-arrest, and I think it's possibly a very, very transient VF.
Ventricular fibrillation, or VF, is an abnormal heart rhythm that causes cardiac arrest. It requires immediate treatment.
We'll pad him up, just in case anything happens en route.
Right.
And we'll go into Wiston as a standby.
QX761 to trauma cell, go ahead of it.
Hi Jane, can you put a medical red standby in to Wiston when you're ready for details?
Eric will be taken to the nearest hospital, 5 miles away.
Is that sickness feeling still there? So up until what happened today, Eric, did you feel your normal self?
Yep.
When you were just doing odd jobs around town? Okay. Right, so you were going to get the bus to go home, so you nearly made it.
He said he ran because he thought he'd lost his wallet, and it was after that that he's had this collapse, so...
Right, so you're going to get...
All right, going to do that blood pressure again. That blood pressure is staying round about the 160 over 9800-ish level. Right then.
Ambulance, is the patient breathing?
In the last hour, Control have received 104 emergency calls from across Merseyside.
Ambulance service, is the patient breathing?
She is. I was just pulling onto the drive, and the lady was on a bike, and I've not seen her, and she's come off a bike into me.
Tell me exactly what's happened.
Okay, I don't exactly know what happened, but his foot's pouring the blood. I just need an ambulance as soon as.
Ambulance, is the patient breathing?
Well, it's actually a car got into a shop.
Okay, I'm going to get you some
He's
salt.
awake.
Okay, he's awake, okay.
Yeah.
Were you with the patient
All right, no
now?
problem. Well, one of our staff is, yes. He is moving.
He is moving, okay. So tell him to be still away for the help, okay? How old's the patient?
He's 88.
He's 88 years old. Okay.
Yeah, yeah.
Okay. Are there any obvious injuries?
No, you've not hurt yourself or anything. No, he doesn't think so.
So where is he now?
He's actually sat in the driver's side.
Is it actually in the building itself?
The car is actually, it's gone through the window.
Gone through the window. So is he in danger now where he is
No,
now?
no, he's fine, yeah.
Okay, right. So is the engine turned off?
The engine's turned off,
okay.
yeah.
Okay, so we have the help arranged. I have informed the police as well, okay?
Yeah,
so
brilliant, thank you.
Is the glass window broken totally, is it?
It's actually more gone into the pharmacy.
It's gone into the pharmacy, okay.
Yeah.
Is everyone safe inside the pharmacy?
Everyone's safe in the pharmacy,
that's great, okay. If anything changes, by all means, give us a call back on 999, and I have informed the police, so they may give you a call as well on the number you've called on, okay?
Okay, yeah,
all
that's
right,
fine.
Thank you.
Okay,
Take care
thank
now.
you. Bye-bye.
Bye-bye.
Yeah.
It's easy done, yeah. Maybe he wants a prescription really fast. I don't know. Bless him.
At Aintree Hospital, Kevin and Michelle have just cleared from their last job.
It's a Cat 1 call, 70-year-old male. He's struggling to breathe.
There is an RRB or still attending.
That's received, thank you.
So the doctor has diagnosed a chest infection?
That was 4 weeks ago, and he's had antibiotics and 3 lots of steroids since then.
Right.
And nothing's gotten any better. And like today I've come and he can't breathe. Someone will be here soon, they all coming, Dad.
Turning around the corner from it now.
So, Al is 71. He's had some left-sided chest pain for the last couple of days. Started last night, been continuous. Coughing, but unable to bring anything up.
Okay.
Sat, as you can see, a little bit low there, 89%, 37.2 is temp. Although he does feel warm.
Has you had any paracetamol today?
No, no pills yet today.
No. Okay. So you've had what?
Cancer.
Okay.
Where's the cancer?
Prostate.
Prostate. Okay.
And is that being treated?
No, from terminal.
It's terminal.
Is he going to go and see to the son, or?
Hello?
He seems to be. He seems very, very upset.
He is.
It's more the ambulance.
Is it more the ambulance that
Is
upsets
it?
him?
Okay.
Okay.
See him in a minute.
Do you want to come and see him? Yeah?
Hey, Jack.
Jack, we've just sorted it out. I'm Kevin. And this is Michelle. You met Michelle?
Hello. Are you going to help us then? You open the packet for us. Can you do that? Thank you.
So, Jack, my name's Matt, and what we're going to do is look after your granddad. And what?
Are you going to put them on him?
So this goes on.
Yeah.
Funny.
Can you do that for me? Fabulous. You have a go at that for me then, mate.
So this goes like this and it goes in the nose like that.
Well done.
So you're looking after your granddad now, aren't you? You're helping.
And then, but I'll put that over that ear. You can put that over the other ear.
Let Grandad know that he's getting some oxygen to help him.
And then
Okay.
this number is going to go up. Okay, and that'll help him.
So if you have a feel for his pulse on the side, is it matching up with the line on there? See it going line, 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 line? Yeah, so it is, isn't it? Okay, so if you let go of that, and then you're going to do
Push
this.
the button just there. See that 12 lead one?
That one. Up one, that's it.
That's it. Push that one.
Fabulous.
Okay.
And just make sure your granddad sits lovely,
Nice and still for us,
no
Alistair.
moving, no talking.
He's good at staying still.
Is he?
Yeah, he is.
That's good. Look at his oxygen levels now. That's because you're fixing him.
Take your time.
Okay.
Well done, Jack. Fabulous work.
Yeah. Good patient handling, mate.
Great. And then do you want to put the foot plates on for us? Is that okay? Just one at a time. So Jack, we're going to be taking him down to Aintree Hospital, okay? So we just want to increase his oxygen levels. He's perfectly fine. You've done a fantastic job, okay? All right, and you've improved him already, okay? Did that help with everything then with him? Yeah.
I'm really scared. Come on, say it, look after you.
So have you heard of something called sepsis? Yep, so it's just basically a very severe infection, okay? We know that obviously you're quite poorly with your cancer, so we just need to keep on top of it and then we'll get you some antibiotics, okay?
All right. Okay.
Well, he's okay. Okay. Like we've said, yeah.
All right. All right.
And like we've said to Jack,
Okay.
you're a lot better now, aren't you? In the sense of your breathing's better. We're going to sort out the pain, and we're going to go and get your chest X-ray done. Okay?
We're here now.
All right.
Okay. Hi, it's Kev on 424. Can we possibly have a amber standby, please, to Aintree Hospital?
We'll wait until we've got out of this road, just so that Jack doesn't see us. But we'll pop the blue lights on, okay? So does Jack understand your condition of how poorly you are and things like that? Yeah. And that's why he panics and, oh. I can tell that you've got a special bond there, you two, that's for sure.
He stays there every weekend, doesn't he, in the holidays. He stays at your auntie, doesn't have safe meals.
Doesn't he? Oh, that's so cute. Oh my gosh. Sounds like just me and my nan. Me and my nan were like that. And we're here at the hospital. Oh, Jack. Oh, he melted my heart. He wants to spend every waking minute with Grandad. Grandad's his world.
Yeah.
And I did ask her, you know, does he know how poorly Grandad is? And both Grandad and the mum said, yeah, he does. Extremely hard.
Every time an ambulance turns up,
yeah,
he thinks that this
Grandad's dying.
Grandad's
yeah.
dying, yeah.
Okay, tell me exactly what's happened.
I can't breathe.
Does he have any difficulty speaking between breaths?
It's getting quite busy at the moment. We've got a lot of shortness of breath. There's a lot of people with breathing difficulties today.
Not alert, breathing rapid, COPD.
Chronic obstructive pulmonary disease, COPD, is a group of lung diseases affecting breathing, which includes bronchitis and emphysema.
We need to keep checking that breathing, OK?
In the last 8 days, the service has received 2,236 calls relating to the condition.
45-year-old female. She's a COPD patient. They're saying her lips and tongue have gone blue.
Merseyside has one of the highest rates of COPD in England.
Ambulance, is the patient breathing?
Not really, no. She's got emphysema and she can't get a breath.
She can't get a breath, OK?
No.
Sorry, I'm just going to get you some help, OK, so these questions won't delay that. So is she awake?
Not very.
OK, I'm organising help for you now. Stay on the line, I'll tell you exactly what to do next. So I want you to watch her very closely, look at any changes, and tell me when the ambulance is due right there with her, all right?
OK.
Thank you.
It's all right. Just try and relax. Just try and relax, please.
Just reassure her. I know it's very stressful for you. Okay. Oh, you're doing brilliantly, okay?
I know. It's very stressful. My mum had the same condition, so I know it's hard. And, yeah, it's very hard. It's our highest response.
It's on the way.
It's okay.
You're the highest response, Mum. It's on its way.
All right.
Nice steady breaths, okay?
Nice steady breaths if you can, Mum.
Okay, just let me know. You're doing really. I can hear these sirens in the background.
I hear it, Mum. It's coming. It's coming. I hear it.
All right. You're doing a really good job. Just reassure her, okay, Becky? Thank you.
It's all right, Mum.
Nice steady breaths, okay?
Is she using the nebulizer?
No, she can't put it on.
Right, okay. All right. You're doing really well, okay?
Thank you. Just try and relax. Just try and relax, please. She's just coming in now.
I'll leave you with the group. I hope she's better soon, okay? All right, no problem. Bye-bye now.
Bye.
Lady. COPD, but looked like she was getting stage something. So it's dead sad. My mum had the same thing.
I know,
yeah, it's that's what she ends up passing away with. So it's awful, and it's so bad. You can hear them absolutely gasping for breath, and it's just dead sad. A poor girl. So.
Do you want to go and grab a couple of sort of chairs?
Do you mind?
No,
Is that all right? Sorry, thanks, love. Yeah, I'm all right. Horrible. Thanks.
Can I make you brew?
No, I'm all right. Oh, excuse me.
Call for someone that had what? Yeah, her mum had passed away from the same thing.
Across the UK, COPD kills 30,000 people a year.
Ambulance services, patient breathing?
Yeah.
And the patient's awake?
No.
Tell me exactly what's happened.
A member of the public has just come over from the second floor balcony down to the ground floor.
Okay.
There's blood everywhere.
It's a long fall, isn't it?
761 Heights, General Trauma Cell. We have got a
29-year-old male at the Museum of Liverpool who's fallen over a balcony.
I wondered if you wouldn't mind running over.
Yeah, absolutely. We'll be at the Wallasey Tunnel in 5 minutes if you can inform.
Dave is immediately sent to the Category 1 call. The air ambulance and 2 paramedic crews are also dispatched.
So we need to control the bleeding, okay? So I'm going to tell you how to stop the bleeding. Listen carefully to make sure we do it right.
Rebecca, X-ray 761, go ahead.
761 is the trauma cell. Some information for you. We're not sure if he has jumped or if he has fallen.
Have you got a defib there? I can't understand. Have you got a defibrillator there?
A really serious incident from the sounds of things, especially in quite a public location. This sounds about as bad as it can get. Hello, I'm Dave. Let's have a quick look here. Blood loss.
This place is closed.
Yeah. So.
We just help.
We got hypostasis. Okay, guys, can we just stop? Race systolic, guys. This is not viable. This is not a viable arrest. If everyone's in agreement, I think we'll stop at this time. If everyone's in agreement.
Sad.
Really sad. It's only
She was.
Sometimes you recognise that some people are beyond help, and all the training and skills and CPR in the world aren't going to be able to help them. It's devastating. It makes you feel shell-shocked, it makes you feel sad. But you have to consider the next patient who you might be able to do something for and make a real positive difference to them.
I've got an update from Dave.
X-ray 761.
Quebec X-ray 761, trauma cell, go ahead, over.
Yeah, just a bit more information for you. Apparently, the patient, when he landed on a female in a wheelchair.
With the crews on scene dealing with the aftermath of the fatality, Alpha 424, Michelle and Kev, are dispatched to help care for the woman who is injured.
That's received, yeah, send it through.
They're 7 miles away.
So you're not able to wake bear through that foot?
I certainly won't be able to walk back to
No,
our car.
of course not. You might need an X-ray on it if you're not able to wake bear through it. How are you both feeling? Were you with?
He didn't see it, he just saw the aftermath.
Oh, Jesus. I mean, that's bad enough, isn't it?
It was horrific. I'm good and bad.
This is Nicola. Are you aware of what the background of the situation is here?
Yes, so I believe there's been a fatality.
Yeah, unfortunately it's a fall from height.
Yeah.
And unfortunately Nicola was sat on the sofa and this gentleman's landed on her right foot.
Right.
Missed everything else, not hit any other part of her body. Full recollection of it. Everything is absolutely fine from that perspective.
Have we had any update on the lady yet?
They were querying a broken foot.
I don't think she's badly injured, but obviously she's going to be...
Yeah, a bit traumatised.
Fine if I walk on my heels.
How are you feeling yourself anyway?
I'm okay. A bit shaky.
But yeah. Just shaking like that one, really.
Absolutely. It's annoying. And he did this, like,
Big thing.
he went, and that's what we could look up for, like, yeah.
Right. So just another set of obs, that's okay?
Thank you very much. See you soon, take care.
Supporting and looking after crew welfare is, to me, the most important part of my job. They are our most precious resource. Without the staff, it doesn't matter how many ambulances or how many defibrillators we have, we couldn't function.
It's the start of the night shift for the Purple team.
Ambulance, is the patient breathing? Is the patient awake?
I want you to get some dry towels and a blanket to wrap the baby in.
Wonky back. What's wonky back? Ah, right, okay. I haven't heard of that.
The ambulance service going to come and give you what? A sandwich? The ambulance service wouldn't come and give you a sandwich.
Ambulance, is the patient breathing?
Hi, yeah, he is.
Tell me exactly what's happened.
I need someone to come and check my little boy. His temperature's 39.8. He's screaming, crying. I can't settle him.
How old is your son?
He's 3.
Does he have any pain?
He's saying his throat's hurting in his chest. He's bright red. Bright red.
Right, OK, my love, I'm organising to help him now.
Right, come on then, Al. Come into my magic little Narnia. You have a sit on here for me? Wee.
Michelle and Kev are already treating their first patient of the night, Alfie, who has been spiking a fever.
Good sign.
All night with him.
Right.
And it was 39.8. And then every time I feel Calpol, vomiting. Literally an hour ago, he would not stop screaming.
He has got a high temperature at the moment. Best plan of action then, we'll pop him down to Alder Hay. I'm going to have a little listen to your chest, OK? With my special machine. Take a big deep breath in for me. And again. And again.
You sound like a dinosaur, mate.
I just got...
Oh.
You've always got claws, then you catch like this.
Oh, wow. Oh, he's got me.
The dinosaur helps. Oh, they smell funny, them. Can I put it on our Ken? Put it on our Ken.
There we go. There we go. How's that?
Right, keep still. Second. Let me take another print.
No, you ready? You ready?
Lovely.
Are you going to put your smelly sock back on?
Yeah.
Go on then, you can put your smelly sock back on.
Like a racing car driver, aren't you? Hey? Wow. This is your racing car.
Go fast.
It's going dead fast. Oh. Let me in. You're going too fast. Right, I'm going to drive.
Say bye-bye.
With all big pedals in the front.
See you at the other end.
See you at the other end.
See ya.
Yeah. Do you want Mummy to sit here so she can see you a bit better? Yeah, come on then, we can swap round. Such a good boy, aren't you? Yeah.
Okay, Shell.
Yeah, ready to rock and roll. Say, ready, steady, let's go!
Although his condition seems to have improved, Alfie needs to be checked at Alder Hay Children's Hospital.
Can you just ask him, has he had this chest pain before someone hit him?
So when his heart's beating, it feels like it's like the lights going in and out on his eyes.
2 hours into the shift, and Control have already received 668 calls.
Romeo 616, thanks Matt. It's a 20-year-old male with a cucumber in his rectum. Matt said, well, I never expected that to.
Hopefully it is a hoax. If not, it
could have been doing a bit of late-night gardening. You don't know.
One of your 5 a day anyway, isn't it? Monday Madness. So the Category 2 calls are well out of time breach now. So it is a difficult juggling act to pick which is going to be first.
Oh.
You've got 2 coats wrapped around you.
I know, because I'm freezing.
Alpha 473 just sent you a cat 2 through.
But I'm going to have to divert you, please. Sorry, just get the cat 1 instead.
73-year-old female.
It did initially say she's a COPD patient.
And she had shortness of breath.
It appears the patient's now gone into cardiac arrest.
No problem, thank you.
Gabby and Gareth are immediately diverted to the patient in cardiac arrest.
Do we know if anyone's doing CPR?
They've not said at the moment whether there's any CPR ongoing.
I don't think so, because it's a first-party caller.
It's a first-party caller?
First-party caller was on the line. Yeah, and then she's gone off the line.
I think I've been here before. Come on, someone be waving us. Come on, where's the doors open? Hello, sweetheart. OK, we're here now. Been struggling for your breath, darling. Let's see. Right, they're on 80%, so let's give you a bit of oxygen now, OK? COPD patient, she was quite blue.
Alpha 473.
Alpha 473, go ahead.
Yeah, just an update on this job. This lady is conscious and is breathing. She's not in cardiac arrest. We'll update you if that changes. Thanks, Laura.
473, that's good news. So it's not a cardiac arrest. The lady is conscious and breathing. Thanks very much for that.
Let's have a little look at your face. Lift your head up.
I'm just going to have a listen to your chest, darling, OK? She's not shifting anything, Gabby. OK. I'll set you up a neb.
We're going to need more than a neb, aren't we?
I'm just going to pop you off this mask and swap it for another one, darling, OK? There we are. You've had one of these before, haven't you, darling? Okay. Yeah?
Gareth gives Margaret a nebuliser to help her breathe.
I know you're going to be a bit panicky because of how you're feeling, but not to worry. We've got more things that we can give you, OK? That's it. You just try and concentrate on getting that inside. Just clear. I think you've met us both before, I think.
Have you?
Yeah. You know what, I'll never forget you because you have a crazy diet. She doesn't eat, she has like shakes, don't you? You still on the shake things?
I haven't had them for a couple of weeks.
Oh, that's good.
I think that's why I'm bad. I was marvellous when I was on there.
93% your oxygen is now. Pardon?
I'll be staying at home.
No, not today. You'll be coming with us. You've probably had an exacerbation of COPD, and if you haven't had it like this for a long time, you need your blood gases taken at the hospital. OK?
I'm going to take you off this now because your SATs have come up. I want to see how you get on.
The crew decide to limit the flow of Margaret's oxygen. Too much could worsen her symptoms.
I don't think she's going to maintain them, is she?
She keeps just dropping to 85. Nice and easy. There we go, my love. Alpha 473, could I have an amber standby to entry, please? You all right, Margaret? Just hold my hand. Just feeling tired, aren't you? Do you feel worse? Yeah. Let's get this one on you. Margaret? 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 You're all right, sweetheart. I've got you. She's exhausted.
Let's get it out, Paul. Alpha 473. Yeah, just to give you a shout. We are now clear and available. Thanks, over.
473, thanks. It's auto-allocated onto this one. It's actually coming...
It was a cardiac arrest now. Lung failure.
Patient, COPD, and now we're...
Cardiac arrest.
999 activate.
Just getting some backup for you now.
That'd be great, thank you.
2 cardiac arrests.
Hopefully this isn't one either.
A second ambulance crew and a senior paramedic are dispatched. Also en route is advanced paramedic Dave.
We're definitely going to be first here.
So listen carefully and I'll tell you how to do chest compressions, okay? You're going to pump the chest hard and fast. So I want you to go 1, 2, 3, 4. 1, 2, 3, 4.
When a job comes in and it's chest pain, I think of my dad. That plays on my mind. CPR is a traumatic thing to do to somebody. There's a lot of panic going on. The biggest thing is the being out of control. Okay, good to go. I'll take the defib as well, Gabby.
Okay.
Yeah, 473, it's Andy, one of the APs on the trauma cell.
This gentleman is a chronic COPD and heart failure patient. His airways occluded. We're struggling to gain an airway. We haven't even been able to ventilate him because of the occlusion of it.
Any signs of any hypostasis or anything?
No, there's no evidence of hypostasis. Riggers the jaws nice and free.
Yeah, Roger. In that case, I think we'll have to continue and attempt to do the 20 minutes ALS. And I've got an AP allocated. He's only 1 minute away, just to assist with any decisions you need to make. Over.
No problem, all received. Thanks for that. Second adrenaline, yeah.
Roger, all received. Just to confirm, TOR on scene, informing police now. Thanks, over. Yeah, they've called it on scene. I'll get the police for you now.
What's TOR?
Termination of resuscitation.
Hi, police, it's ambulance here. Could we have your attendance, please, for a termination of resuscitation? We've arrived on scene. Best efforts, but unfortunately this gentleman's passed away.
Just leaving family, just have a bit of time alone with him. His wife, just so you all know, is really grateful for everything that we've done for him. And I'd just like to say thank you as well. You know, jobs like this are always hard. They're almost the hardest ones.
They're the worst ones. I've struggled with that.
It's between where you have to have that decision between this is obviously not something that we can deal with, or this is obviously something we can deal with. These ones, which are the middle ground, are always really challenging. And I'd just like to say you all did a really good job. Do you have anything you guys want to ask, or any questions or any points you want to raise at all to me whilst I'm here?
Are we allowed to stop it after like 10 minutes though? Is that allowed?
That's one of the reasons why we're here as well, is to come and help support you with that decision making. I'd just like to say I utterly support any decision you made on that, because it was a difficult judgment call for you guys to make. It would have been a difficult judgment call for me to make if I'd been first on scene. But it's obvious, it's such a sad job to go to. Anything like this is always a sad job to go to.
I've got to say, you were really good, Gareth, by the way. You literally took control and was like, no, come on, we've got to do it, and thanks for doing that.
So, moving on from here, what I always say after this situation is, is everyone okay? And I don't expect an answer to that because I'm not sure everyone is okay, but I'll do a trim request on this one.
Crews are encouraged to discuss distressing incidents in sessions called TRIM, Trauma Risk Management.
People think trim request means that you're automatically going to get referred for counselling. It's not about that at all. You don't have to accept it.
It's really good. I had one after the keys arrest. It's good.
And what they do is they speak to you and you basically go through a questionnaire, and it's about helping you identify how you feel and whether you want any more support on it, and it's entirely up to you.
Oh, I don't like jobs like that.
No, neither do I.
It's not good. Like the AP said, though, at least the family have seen, seen
I like
it and
that.
took comfort. I like that. I like what it, you know, it makes you think of it perhaps a little bit different, doesn't it?
Yeah.
When I first started, there wasn't really any support. You were expected that this was part of your job, and it is part of our job. But that doesn't mean that we shouldn't feel upset or just think about jobs like that. Of course we do. We're human beings. Now we are encouraged to express our thoughts and feelings and get help when we do need it. That is one of the best things we've ever done in the ambulance service.
Just for now, just leave the baby between mum's legs. Just watch them both very closely, okay?
I can see a baby.
I love that.
What's a child?
A boy, no name, baby boy. You should be very proud you've delivered your own baby.
Pump the chest hard and fast 30 times, at least twice per second and 2 inches deep.
It's just an update for you from Romeo 663. This lady was sold 1 gram of ketamine, which he's snorted.
This is an 87-year-old female who's not fully alert. Severe abdominal pains on the left side.
It's like being back in Wales.
I know, I was thinking that.
I'd love to have my own farm, you know.
I know, I would. Have you ever done
I wonder if
farming
this woman still works the farm. Because in Wales, I've been to a few farms, and there's like 90-year-old people, and they're still working.
Oh, and that's how I think you live longer.
Yeah. Got away with it.
She looks a bit distressed, actually, doesn't she?
Oh, she's fallen over.
Shit.
Oh, no.
Are you all right? You okay, lovely? I've got you. We'll have a proper talk once we get in the ambulance. Oh, God.
Right, there's a couple of handles there, darling, and then once you get so far...
I've got you, and Gareth's got you as well. Well done, darling. Does the pain get worse when I press or when I let go? Is it when I press? Okay. And how long have you had the pain for? Did it wake you up?
Woke me up about an hour ago, I suppose.
Do you want to sit up
Come
a
in, I'll
bit?
just...
What was your name?
Margaret.
Margaret.
Yeah.
Has she been eating and drinking?
Yes.
So this has come on all of a sudden then, is it?
Yeah, I think so.
I'll start off with giving you the IV paracetamol.
Yeah.
Am I okay to put a needle in your hand?
They're a bit hard to find at my age, aren't they?
Is this real?
Yeah.
No way!
Oh,
Wow!
I know.
She only done about
that? About 5 months.
I am so impressed. You're like the coolest man
Yeah.
ever, aren't you? Wow!
That is really nice, isn't it? Yeah.
Dragonfly?
Yeah.
Yes.
Yeah. What does it represent for you?
I just love dragonflies.
Really?
Yeah, I do.
Oh, I'm really impressed.
It was good because it was 3 generations. It was Mum and my sister, and my sister's
Her
daughter.
Right, anyway, I'll make myself useful.
I think he wants to become a farmer.
I do. I'd love to be a farmer. I love it. I do. I'd love to be a farmer, mate.
It's not a way to ever get rich, but it's a nice quality of life.
We were just saying on the way, it's a lifestyle, isn't it? More
You haven't
than
got a
job.
daughter, have you?
Yeah.
No, I've got an 18-year-old son.
You trying to palm me off again, eh?
Trying to get rid of him. Watch, there's a cat.
There's a cat.
grateful to you all. You're wonderful people.
Oh, thank you, but this is what we love doing.
Well,
we love looking after people.
that's wonderful.
'87, they were getting a tattoo. That was amazing. I haven't even got one at 31.
You'll go and get one now, will you?
I'd look stupid. I'd look as though I've just drawn on myself. Do you think? I'm like pale as anything. Sing veins. I might get a blue tattoo and just say...
That's to get love and hate on your knuckles.
Don't let the sun catch you crying.
Looking forward to our rest now. I've hit the wall about 5 o'clock, I think. 6 o'clock, hit the wall. And I'm going to go home. I'm going to have a lovely 3 days off.
Put on the green uniform.
Do it all again. Let's go home, eh?
Yes. Call it a day.
Don't let the sun catch you crying.
When my dad died, the ambulance crew came, patted me on the shoulder, and that was it. They walked out. Nobody really told us what was going on. I always try and speak to the family. It's so important being open and honest with them. The experience with my dad provided the root of everything I do today as a paramedic. That experience makes me want to be the best I can be.
Oh, let's go. We know that crying's not a bad thing, but stop your crying when the birds sing. It may be hard to discover that you've been left for another, but don't forget that love's a game, and it can always come again.